Hello everyone and welcome to a new session of clinical pharmacology, drug therapy and clinical research. I am Dr. Khalid Hassan, professor of clinical pharmacology and drug therapy. In today's videos we are going to speak about beta-adrenergic drugs which include agonist and antagonist medications, and this group of medication belong to the autonomic nervous system. Stay tuned. So as you can see here in this slide, we have a beta-adrenergic drugs. Adrenergic stand for the adrenaline, and this belong to the catecholamine medications. We are going to speak about agonist and antagonist. Agonist mean any medication able to bind to the receptor and activate the receptor, and antagonist any substance or medication able to bind the receptor and block the receptor. So as you can see here, we start with the beta-adrenergic agonist, very important medication. In order for us to understand beta blockers, we need to know and maybe understand the action of beta-agonist and the clinical use of beta-agonist. Then we can maybe conclude how the beta blocker work. So according to the beta-adrenergic agonist, here we talk about a group of medications that able to bind to the receptor, bind to the beta receptor, and activate beta receptor. First of all, we need to remember we have three subtypes of beta receptor. We have beta-1 receptor, we have beta-2 receptor, and we have beta-3 receptor. And in the next coming slide, we are going to speak about beta receptor distribution in our organ. For example, we have beta-1 receptor in the heart. We have beta-2 receptor in the lung or like respiratory system. We have beta-3 receptor in the adipose tissue and in the bladder. Therefore, we have medication affect these organs. For example, for beta-1, beta-2, and beta-3, we are going to maybe focus on that medication in our maybe brief lecture today. Regarding beta-adrenergic agonist, as you can see here on the slide, the first and prototype, first medication, epinephrine, and we have several brand name for epinephrine, followed by dopamine, dobutamine, isoproterenol, albuterol, salmeterol, and decatrol. I will repeat it. We have epinephrine, dopamine, dobutamine, isoproterenol, albuterol, salmeterol, and decatrol. Okay, regarding speaking about the brand name, generic and brand name, do you need to know that? Yes. For the clinical practice, when you are in the practice, even like pharmacist or like prescriber, physician assistant, nurse, you need to know the generic and the brand name. So as you can see here, for epinephrine, we have adrenaline, and then we have EpiPen. For dopamine, we have inotropin or inotropin. Then we have dobutamine, Dubutrex, dobutamine. Then we have isoproterenol. Then we have albuterol, Bro-Air, and Proventil. Then we have salmeterol, Servandescas. Then we have indicatrol, Arcapta. Okay, so this is a group of medication represent the most popular medication belong to the beta agonist. Here we talk about medication that able to bind to the receptor and stimulate the receptor. So we have epinephrine, and this medication used for allergic shock, for example. We use epinephrine with the local anesthetic to reduce maybe bleeding, to increase activity of local anesthetic, and to prevent systemic effect of local anesthetic. So we have several benefits of epinephrine adding to the local anesthetic. Dopamine, another medication, stimulate dopamine receptor, stimulate beta receptor, and with the increasing dosing or different doses stimulate alpha receptor. Okay, dobutamine mainly stimulate beta-1 receptor, and this one available in the heart. For this reason, dobutamine used mainly for acute heart failure. So as you can see here, So we have beta-1 and the butamine selective stimulator of beta-1 receptor. Therefore, we use it for acute heart failure. Here we talk about emergency situation. Isoproterenol stimulate beta-1 and beta-2. Stimulate both. Isoproterenol stimulate beta-1 and beta-2. So we don't use it in the practice because sometimes we need to be selective. We don't recommend to use medication stimulate 2 receptor because beta-1 available in the heart, mainly predominate in the heart, beta-2 predominate in the blood vessels, predominate in the respiratory system. So we don't recommend to use medication affect 2 main organs in our bodies, for example. You can imagine someone suffer from asthma and we use isoproterenol for this asthma, but this patient suffer from, in addition to the asthma, from hypertension. As you can see here, when you prescribe isoproterenol stimulate of beta-2, this will lead to the bronchodilation and relief symptoms. However, stimulating beta-1 in the heart, this will lead to the increased blood pressure and increased heart rate and may cause stroke or may cause myocardial infarction. So we don't recommend to use non-selective medication for like disease. It's not recommended. It's recommended to use selective medication. Okay, moving to the next medication on the list, we have albuterol. As you can see here, albuterol. Albuterol mainly stimulate phentoline or raw air, mainly stimulate beta-2 receptor, and this is mainly available in respiratory system. And we use albuterol inhaler for patients suffer from asthma or patients suffer from COPD. Again, we need to differentiate between asthma and COPD. I recommend you to review my lecture on YouTube about asthma and COPD, what type of medication we are going to use as first-line therapy for each case, asthma and COPD. Okay, so then we have salmeterol. So as you can see here, we have tirol, and this is inhaler. And then we have salmeterol, another tirol, and also inhaler. And they said this one also stimulate beta-2 receptor and used for asthma and the respiratory system. So the question here, what is or are the differences between albuterol and salmeterol? The main differences, albuterol considered like short acting and salmeterol considered like long acting. Sometimes like medium acting or moderate acting. Indicatrol, another inhaler for the asthma, stimulate beta-2 and used for asthma mainly. Sometimes we use it for COPD. Okay, it depends on the situation, not the first line. Okay, we have LABA and we have MABA. So you can see here we have Arcapta, for example, the brand name. So from this list here, you can see it here. We have different category for the beta-adrenergic drugs. In the next session, we are going to speak about beta blockers. So the next section will be, or no, the next session will be beta antagonist or beta blocker. For this reason, we recommend you to follow this next session about the YouTube channel about beta blocker. Thank you for your watching and have a great day.